quite often rats or mice, that are carried out with laboratory practices, laboratories. And then the second step is to figure out how much people are actually exposed to. And so there's lots of different ways of figuring this out. People can wear dosimeters, or they measure quantities in food and water and so on. Through all these different exposure pathways. And so for children or for adults, for workers, they figure out how much of a particular chemical, one particular chemical, people are being exposed to. And then the third step is to compare what they found did not make an animal sick with the amount that people are exposed to in some kind of cumulative way, and make sure that there's a factor of, a factor of 100 or a factor of 1,000 between these two. Now the catch here is that there always has to be this factor of 100 or a factor of 1,000 between the amount that people are exposed to and the quantities that they use in these animal experiments, because otherwise there's no way that they could pass the regulatory hurdles. So all animal testing has to be high dose, and it's not because the pesticide companies or the chemical industries are bad people or anything. These are the rules that are set out under our regulatory regimes. But what we're finding now is that there are effects at low doses that are not actually seen at high doses. And this is kind of counterintuitive, but it's due to disruption of the endocrine system. And for instance, these two mice, the fellow, the big fat guy over there on the right-hand side, he had 1 part per billion of a drug called diethylstilbestrol in his drinking water. And then the fellow who looks quite normal and was behaving normally and so on actually had 100 times that much in his drinking water. So the very low dose had an effect, whereas the higher dose didn't. And there's some possible reasons to do with the operation of the endocrine system, and also to do with activation of detoxification enzymes within these animals. But this is actually what's observed. And these kinds of effects are observed with a lot of environmental chemicals. So it's really, really important to have the data that is relevant, at relevant concentrations, and that just isn't there for many of the chemicals that we have in commerce. And this is actually known by the chemical industry. The American Chemical Society is it's an organization of the industry, and so Dow Chemical and so on, we all belong to this society. And they put out a statement that says a large and growing body of environmental health literature shows that endocrine disrupting substances have complicated dose-response curves that do not fit the central tenet of regulatory toxicology, namely that the dose makes the poison. This makes it impossible to predict the effects of low-dose exposures based upon high-dose experiments. The effects can be not only different, but opposite. But this is the basis on which we have all of the chemicals that have been assessed, that are on our shelves, have been assessed according to the central tenet that the dose makes the poison. And we know that that's not true. It's also recognized by the pesticide industry. The Dursban is an insecticide. It's used to kill cockroaches. And it says right on the label, caution repeated exposure to cholinesterase inhibitors, that's how this insecticide works, may without warning cause prolonged susceptibility to very small doses of any cholinesterase inhibitor. Now if this isn't chemical sensitivity, this is the definition of chemical sensitivity. And of course, all of our chemical assessment is based on single chemicals, but we are all exposed to many different chemicals. There are multiple exposures and cumulative effects. And for some of these, we know that they're actually greater than additive. So, for example, with pesticides and with fragrance ingredients, and with toxic elements. In the US, they've just started looking at this, and they found that if you take the brain toxicity of lead and of arsenic, and try to predict, based on those two, what would happen to mixtures, then you underestimate it. They're synergistic. The same with cadmium and lead, the same with lead and methyl mercury. So what happens with mixtures is not easily predicted, just knowing a single chemical toxicology. Now I'm going to quickly run through some of the types of chemicals that we have to be concerned about. And the first would be toxic metals. So the four that we recently looked at in some of our work and that are considered to be kind of the top four are mercury, which is in mercury amalgams and in fish, lead, which is in dust, it was in gasoline, so it's in a lot of soil, water, paint, it's in batteries, and many, many products. There's all sorts of recalls because of lead in paint and children's toys and so on. Cadmium well, all of these elements actually can be hyperaccumulated in plants. Cadmium is particularly hyperaccumulated in tobacco, so there's a lot in cigarettes, in various foods, in batteries again, and various products. And arsenic is in, again, our food and our water, and in the copper chromated arsenic pressure-treated wood, the green wood, it's now banned, but there's an awful lot of stuff around that is made of this wood. And of course, there are a lot more toxic metals. Another class of materials would be plastics, and the oily stuff that they add to the plastics to make them flexible and so on, which are plasticizers. The plasticizers can leach out. The plastic is pretty well bound, so it stays put. There's been a lot of talk about phthalates. Some phthalates are now banned from children's toys and things that children mouth. There's also a lot of phthalates in vinyl, so vinyl furniture and artificial leather clothing and so on. There's also lots of vinyl in shower curtains, and we have to be concerned about children's toys. And then another thing with plastics is that quite often they will off-gas a lot of materials. So if you want to stick with safer plastics, then you'll not use things that are number 3, the vinyl or the polyvinyl chloride. Sometimes it says PVC, or polystyrene, or the others, which who knows what that is. Another class of chemicals are what we call volatile organic compounds. They smell. And quite often, along with these VOCs, we get particulates. For instance, in exhaust and in smoke from various industries. A lot of pesticides would be considered volatile organic compounds, and there's a lot of volatile organic compounds that are let off by so things like pressed wood and building materials and paints and gyprock. And then, of course, in beauty products and perfumes and in cleaning products and laundry products. Now, there's a lot of research on health effects of perfumes because they do have neurological effects and they can affect the blood pressure. They're a common initiator of environmental sensitivities, and they can also trigger the symptoms, both of environmental sensitivities and asthma. And there's even a case report of a healthcare worker with no history of asthma who was sprayed in the face, fortunately at work, and suffered anaphylaxis. She was in the hospital at the time and was quite disabled even quite a while afterwards. And we know that between 16 and 30% of the US population feels that they are especially sensitive to perfumes. This is my favorite. No sense